And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Good morning, it's Tom Lucas. We're back with you, and back in studio with us, our favorite doctor, dentist, friend of all time, Dr. Ronald Zokol. How official, huh?
Good morning, Tom.
How are you? How are you?
I'm well, thank you.
I've never seen you without your doctor's gear on. You look very casual today.
I try to be on a Saturday.
You've got your BC Perio golf shirt on?
I do.
It's pretty snazzy.
It's almost like I can play golf a bit.
You too?
I try.
Oh, well, I thought it just was in the blood.
Some of the Zokol family have it in their blood, that's for sure.
Well, yeah, but they're not dentists.
Nah, that's true.
There you go. There's a special thing. So I'm glad you're here today. Let's look at the situation. It's summertime. We're into August already. Kids will be going back to school soon. There's probably lots of people, Ron, that are listening to our show that haven't done anything with their teeth in years, and now they're thinking to themselves, oh, gee whiz, I'm 65. I'm too old to be going to the dentist.
Not true.
Really?
Oh. Are you kidding me? 65 is about the time when far too many people, have broken down their dentition through constant wear over those past 50, 60 years. And now they got another 20, 30, maybe even 40 years to live. And what are you going to do? Those teeth likely won't last without some type of help. I think there's got to be a time, and I think everybody should have a chat with their dentist and say, look, if I'm 50, 60, 70 years of age and I'm still healthy, and many, many people are these days, then what is my dental bill going to look like down the road? And will I be healthy and stable enough to undergo treatment at that time? Or should I consider getting it done earlier?
That's what I like about BC Perio, and that's what I like about coming to see Dr. Ron Zokol. You'll sit in the chair. We'll have a complimentary get-together, complimentary consultation. We'll talk about things. I'll say, I think there's two things to be taken out, and you'll say, yes, it does, or no, it doesn't.
Yeah, that's true.
Yeah.
And many times we'll say, do you know something? We can fix it. Let's not take it out, because we can spend less money, give it a lot more years of life, and even then you may not have to have an implant. But let's not take it out too quickly, especially if we can give it a bunch of years more. Well,
the advice you're giving on the radio today is well versed, because you've been doing this for, I hate to say it, but for a long time.
Yeah.
You've been on the radio for a long time. You've seen a lot of patients over the years.
Yes.
Why do the people come to see you, other than to make their smile look nice?
Oh, gosh. Well, you'd probably have to ask the referring dentist why they send them to me. And I suppose my guess is that I tend to do things that are more challenging and get decent results for it. So by and large, a lot of dentists can do the simple, easy stuff, but the stuff that takes a little bit more complicated work, a little bit more advanced experience and training, those are some of the cases that are often sent to me.
Somebody comes to see you, they haven't been to the dentist for years and years and years, you talk to them, they finally tell you, Dr. Ron, I'm 6'9", but I'm a big chicken. I'm afraid of the dentist. What happens?
Well, actually, some of the people who had the greatest anxiety about being in the dental chair are very, very big men who are used to controlling their environment. And to sit in a chair and put your course of activity for the next hour, an hour and a half in somebody else's hands where you can't do it is really difficult for many people to do. And when you're in a dental office, that's pretty much what you have to do.
Well, you've been around for a long, long time, and I say that with all due respect, but now you're in a fairly new office. You've been there for a little over a year, is it, I think?
Yes.
So you moved from, everybody knew you from being down there by City Hall.
Yes.
But now you're down in the Broadway shopping area.
Yeah, 777 West Broadway.
Broadway at Willow.
I'm sorry?
Broadway at Willow?
Broadway at Willow,
You work
yes.
with some other fine dentists?
I do. A group of periodontists that are incredibly great people. Good dentists and good people to work with. It's a pleasure being there. You're right, it has been a year plus now, and wow, we're having a good time. And we're doing some great things in this office. BC
Perio, just to get things clear in our listeners' mind, is not a place where you'd say, Mary, our granddaughter Sally needs to have braces. Let's take her to see Dr. Ron Zokol. You don't do that kind of stuff, right?
No.
Okay.
No. And think about what perio means. Perio means around the tooth. It normally is associated with a gum tissue. But as of late, in these past number of years, when it comes to advanced treatment, be it extractions, be it bone grafting, soft tissue grafting, implant placement, rebuilding of teeth. You're looking at periodontal surgeries as one modality of care. You also have prosthodontics. And at BC Perio, you have Dr. Birdie and I who do the advanced prosthetics, and all four of us as surgeons will treat the periodontal issues.
And just to rest people's minds a little bit, people who are thinking about maybe I should go see Dr. Ron Zokol, but I really haven't got the nerve. I keep hearing him on the radio month after month, time after time. I should go and see him, but I really don't have the nerve. There's nothing really to be scared of, is there?
I think not.
No?
And I think, quite frankly, and we deal with this with just about everybody that comes in. Many people have some apprehension if they've got very little experience with a new dentist. And what I say is this. I said, many people come here with the same sense of anxiety and concern, and it's completely understandable. However, once you get partway into your first treatment and realize that it's not painful, the people who do come in here with all that anxiety find it evaporates very quickly.
And the other thing, too, is a listener did call you on one of our shows, I remember, saying, Doctor, I'm in a lot of pain. The first thing you said was, let's get rid of the pain first.
Sure. Yeah, first things first. Get rid of the pain, get rid of the active disease, and then we'll think about the possibility of rehabilitating the damaged tissue.
The great thing about going into BC Perio, I find, as soon as you walk through the front door, your support staff is doing the job. They're supporting. They're making people feel welcome. They're making you feel a little more at ease.
I think it comes down to service, Tom. My sense is that when people come in, they have an issue. And often the issue is either painful or very uncomfortable or unsightly, and people are very sensitive to each of those problems. And if people in our office are not aware of that level of sensitivity and that people are hurting in some way and are looking for assistance, if you can't relate to that, you got no business being in the field.
What if somebody is, I like the expression used, hurting? What if they're not physically hurting, but spiritually hurting because their teeth are not what they should be? They're a little nervous to even let you look in their mouth.
No, you're right. You're absolutely right. And hurt does come in different forms, and it can be physical pain or it can be emotional hurt. It could be a high level of sensitivity because you know that your smile, when you do smile, perhaps could be better. Those are the things we do treat.
What I like about you and the rest of the dentists and your entire office is you have not sympathy but empathy for people that come through the front door.
It helps.
It helps.
How do you relate to people if you don't at least bear some semblance or at least recognize the type of difficulties they're having? And I think when somebody's been around for 20, 30, 40 years in this field, you've probably seen the majority of issues that do crop up, and I think the majority of us who've been around that length of time probably understand and have empathy.
You're probably not seeing anything new coming through the front door?
Probably not.
Probably not. You've probably seen it once or twice before.
I would think so.
What happens, there's let's go back to the 65-year-old guy. He hasn't been to the dentist in years, and now he's kind of embarrassed, but he says, you know what, I'm probably the only guy in the world that Dr. Zokol is going to see with this condition. I don't want to be the one.
Yeah, that's not the case. It's just so prevalent. It's unbelievable. And it's so easy to put off as well. I can't begin to tell you the number of people who have come in who admit to procrastinating for the last 5 to 10 years. And now their work is a lot more difficult to treat and probably more expensive as well. What we find in dentistry is that if you have issues in your mouth of one form or another, it almost never gets better or less expensive. So we say this is that if you do have issues, find out what they are, number one. Number two, choose a plan of treatment, wherever it might be. And if you do that, and you do that expediently, you'll probably pay less and have your teeth for a longer period of time with healthy.
Do you still have the free consultations?
Of course.
Let's talk about that in a minute, shall we?
Sure.
All right, so if anybody wants to get some more information or they want to drop by and say hello or make an appointment, it's BC Perio online, bcperio.ca. bcperio.ca. 2 addresses for you in Vancouver, 501-777 West Broadway. That's 777 West Broadway at Willow. The telephone number for that clinic, 604-872-0222. 604-872-0222. In Coquitlam, it's number 250, 1175 Johnson Street. That's number 250, 1175 Johnson Street at Glen Drive. And the telephone number at the Coquitlam Clinic, 604-936-8244. 604-936-8244. You're listening to Boomer Life on Smooth and Easy CL650. It's Dr. Tom Lucas with Dr. Ron Zokol. See, I just promoted myself there.
celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.